Today is July 27th, 2024, and I've got an interesting update on the versatile uses of hyaluronic acid, or HA, in aesthetic medicine and wound healing. Hyaluronic acid's abilities extend far beyond what we typically think of in skincare. It's a naturally occurring component in the extracellular matrix, and it plays a critical role in numerous biological processes. We are talking about cellular proliferation, differentiation, migration, signaling, and inflammatory responses. It's even involved in angiogenesis and tissue regeneration. Currently, hyaluronic acid-based formulations are making significant strides in anti-aging treatments. Whether it's creams, gels, or dermal fillers, they offer substantial benefits for skin aging. These products help to hydrate the skin, reduce wrinkles, correct tear trough deformities, and restore facial volume with their excellent biocompatibility and biodegradability. What's fascinating is the potential of hyaluronic acid in wound healing. Thanks to its unique properties, it's an ideal material for tissue regeneration, facilitating quicker and more effective wound repair. This dual role in both aesthetic enhancement and medical treatment is truly impressive. As we look ahead, the challenge remains in optimizing hyaluronic acid-based compounds to maximize their effectiveness in skin regeneration and tissue repair. But with ongoing research and development, I'm optimistic about the future applications of hyaluronic acid in both fields. That's it for today's Aesthetic Medicine Minute. Thanks for tuning in, and remember, keep your confidence sculpted.